Hi guys, Dr. Afan here, and today we're discussing composite bonding. So what is composite bonding? So composite is essentially a plastic, and what we do is we have it in a moldable form. And we place it onto positions in your teeth, shape it, and then set it. And once we've set it with the blue light, it sets into a plastic on your teeth, essentially a composite. Once the composite is on your teeth, we can shape it, contour it, polish it, and once we've refined it and it looks just right, we will show you the mirror and show you what you think of it. So essentially the composite tends to last 3 to 7 years depending on how you look after it. It will need changing, so in 3 to 7 years time, when it looks a little bit discolored and dated, we will change it. It can stain around the margins, so that's why it's so important that you come to see our hygienist. We have strict protocols of how to look after composites, so we will do our level best to keep them maintained as much as possible. They can chip, so if the composite flicks off or chips, you will have to come back. There's a small charge to pay to repair it, but usually it's a very small procedure, so it takes about 10 minutes to repair, so it's not the end of the world. And sometimes what happens is when we create the shapes, we try to create them in a certain way, but when you're eating and gliding your teeth, your bite is not allowing that shape to last. So we then think, right, okay, maybe let's just change the shape slightly rather than rebuilding the shape to that same height and then it chipping again. So we'll go through that if it does chip. So essentially 3 to 7 years, it can chip, which has a small charge, and it can discolor, and as time goes on it will discolor and then you need it getting changed. In terms of the positives of composite, there are so many. It's usually a procedure that doesn't require masses of tooth preparation. And by tooth preparation, I mean drilling down your enamel into dentine and things like that. Usually it's a very simple procedure. Now, in some cases, you may have a tooth that sticks out slightly. And if that tooth sticks out slightly and we start adding composite on, guess what's going to happen to your tooth? It's going to look like it sticks out even more so. So in those cases, it might be advisable to move the tooth back into the right place first, then we go ahead and do the composite. But if that's not an option for whatever reason, it may be that we have to shave ever so slight amounts of your tooth off before we move, rather than moving it back and then adding the composite. But those are very, very few and far between cases. And if your case has a component of that, we will have made you aware 100%. So hopefully you won't need any of that. Now, in terms of the procedure itself, it's a very simple and easy procedure. What we tend to do is we put a blue sheet on your teeth, and the blue sheet just keeps your lips out of the way and your environment as dry as possible whilst I'm working on your teeth. Ironically, the composite works well in a dry environment. And the fact that we've got so much saliva means my dental nurse and I will do our level best to keep the saliva as dry as possible, so there's very little moisture contamination whilst we're carrying out the process. So essentially we put the blue sheet on to keep your teeth dry. We then put an antimicrobial jelly. It's usually a blue jelly, and we put it onto the teeth and we massage it into the teeth, and this process takes about 30 seconds, and then I blast it with water to get rid of all of that, and then I dry it. And once I've dried it, I get this crystalline white appearance of the teeth where, you know, it's nicely clean and it's ready to start bonding onto. I then get a very small sparing amount of glue or bond, hence the word composite bonding, and I rub that onto the areas where I'm going to be placing the composite. So for example, with edge bonding, place it onto the edge. I will then start adding a small increment of composite in those areas, shaping it with my instruments, and then once I've done that, I usually get my dental nurse to set it with a blue light, and once she set it, we go on to the next one and the next one, and once we've done all of them, we then start contouring and shaping them with little instruments to make sure that they're the right shape, the right height, the curvature on them is right, the axial inclination is right, so we go through all of those things to make sure it's as good as possible. Once we're happy with the result and we've polished it, we've made it look nice, that's when we say it's time for you to look at it. So it's actually a very simple procedure. We've done quite a lot of these here and I've got a lot of experience with it. I've graduated in 2013. I'm involved with a lot of courses that I've been on. I went to Japan to learn from Dr. Takahashi. I've been to Belgium to learn from GC Genial. I've been to Germany to learn from Coltine. I've studied on the postgraduate diploma in Advanced Aesthetic and Restorative Dentistry with Dr. Sabir Banerjee. I've studied on the Clear Aligner Therapy diploma with Dr. Raman Aulak. And now I'm very humbled that I'm in the position where I do teach. So I do teach composite dentistry, and I teach as part of postgraduate diplomas for Dr. Sabir Banerjee, Dr. Raman Aulak, Aligner Consulting. We did a course with Aligner Consulting and Invisalign called The Final Smile, where we taught it as well. So I'm very lucky that I've done a little bit of teaching as well. But as a dentist, we're on a learning pathway, so we're always trying to learn and reflect and get better with our skills. But I'm very lucky that you guys have trusted me, and I'll give my full 100% to you and do my level best to get you a nice smile. But do be aware that there are some teeny weeny risks that you need to be aware of. If you have any questions before you start the process, don't panic, let me know, I'll do my best to help. Now, the final thing I was going to say is, what's the difference between composite edge bonding and composite veneer bonding? So composite edge bonding refers to putting composite just on the areas where it's necessary. So for example, if you have a teeny weeny tooth and you want to make it broader, it will just be on the areas where it's needed. Now, the composite veneer bonding, on the other hand, is where we cover or veneer, so I slap the composite all over the tooth surface. So you're kind of hiding even the healthy part of the tooth and the areas where you need to edit. So essentially, it's a little bit more composite work. Now, from my perspective, it doesn't matter which choice you choose, but from my perspective and from my anecdotal evidence, I personally feel if you get the composite veneers, they are more likely to stain around the gum margins. They need to be maintained a lot more, so you need to come to the hygienist a lot more frequently. Make sure you come every 6 months. You need to be a little bit aware that once your composite does discolor, because you've got so much of it on, you need to then get it redone. And if you've got the composite veneers, you can't just have one tooth done most of the time, because one tooth will then stand out like a sore thumb. So you will need to build upon a few teeth on the top rack to make them look like they're all identical to each other. And whilst we're on that topic, if we get the top set done, guess what happens to the bottom set? So the bottom set will stay the same color as it is now, but the top set, if you go for a super white composite veneer look, you're then going to have a super white top set and the bottom set won't match unless you get the top and bottom done, but then you're spending more money. And then there's more chance of chipping and things like that. So you've got to put that into account. So again, you need to think about which sort of style you're after, and do remember that 3 to 7 years time, you have to change these things. So again, there's a cost at that point. But by and large, it's a very simple and easy process, and we're here to support you. I wish you all the very best, and thank you for trusting us. Good luck with your procedure.